In this education session, we will discuss COPD symptom management and how to easily clear secretions. The objective of this presentation is for you to better learn self-management in terms of your symptoms of shortness of breath. We will review how breathing works. We will review technique to help you decrease your shortness of breath. And we will go over a few techniques that would help to clear secretions. When you live with COPD, it becomes very quickly obvious that certain day-to-day activities are becoming more and more difficult. Things like walking, getting dressed, taking a shower can become major challenges. To further complicate things, a flare-up can really throw your quality of life out the window. But there are things you can do to overcome and prevent the limitations from the condition. And overall, it will improve your feeling of well-being and your quality of life. I want to do a little test with you. You will put one hand on your chest, the other on your stomach. And I just want you to breathe normally. And try to focus on what hand is moving the most and what is happening when you're breathing in and when you're breathing out. Is your chest moving up? Is your stomach moving out? Are the ribs doing more work? How breathing works. On this gentleman here, that red line that we see, that's your diaphragm. That is the major muscle for breathing. When it's resting, the diaphragm is up inside your chest, pushing a little bit against the lungs. When you go to take a breath in, the diaphragm contracts, pushes down inside your abdomen, which makes the abdomen bulge out a little bit and allows the lungs to inflate and the air to come in more easily. When you're breathing out, the diaphragm relaxes and moves up into that rib cage, pushing those lungs to expel the air. There are also some other muscles that can assist the diaphragm to breathe. There are muscles situated around your neck and your chest and those little muscles that are between each ribs. Symptom management. In COPD, what happens is that the airways lose their elasticity and there's also inflammation in the airways itself. So this makes it difficult for the air that goes in to come back out again. That loss of elasticity make it so that some of the air stays trapped into some of the lung structures. And that trapped air causes the lungs to stay a little bit inflated at the end of each breath out. So if there's air trapped inside the lung, that means there's less space that is free for the new fresh air to come in. And then breathing becomes more and more difficult due to that trapped air. And the other thing that happens is the lungs being a bit inflated pushes that diaphragm down already. So the diaphragm has a little bit less space to contract and relax. So it's always a little bit contracted, so it cannot exert the same force to make that breath in very efficient. Therefore, the accessory muscles from the neck and your ribs will be used more to help you with your breathing. It's okay, but it comes at a cost. It takes much more energy because those muscles are much smaller and that's not what they're designed for. So you get more tired, you get more short of breath, and you start to do a little bit less activity each day. The goals of COPD management is first and foremost to relieve your symptoms. It will help to slow down the disease progression. It will improve the tolerance you have to do your day-to-day activities. It can help to prevent and manage complications, and it will definitely improve your quality of life. There are several things you can do to better manage your symptoms. So what can we do about that trapped air? Well, simple solution would be get that trapped air out. It's easier said than done. One of the best things you need to do is take your medication, your puffers, regularly as prescribed to you. Those medications were designed to help reduce the inflammation and open up those airways. It causes a dilation of those air channels so that more air can get in and out. Pursed lip breathing technique can also help to relieve some of that trapped air. And there's also some posture or different body position that can be used to help reduce your shortness of breath. We'll go over some techniques to help clear secretions such as coughing and huffing. Pursed lip breathing. You might already be doing this without realizing it. We want to emphasize breathing in through the nose as much as possible because the nose acts as a filter as well as a warming channel to warm the air to get to the lungs. So take a nice gentle breath in through the nose and fill your lungs with air. When you go to breathe out, you will purse your lips as if you were whistling, or if you were going to blow on a candle, but you don't want to put that candle out, you want just that flame to flicker a little bit. So slow and controlled breath out through pursed lips. The idea is to try and make your breath out a little bit longer than your breath in. So at the beginning, when you're practicing this technique, you might want to count a little bit in your head. So breathe in for a count of 2, try to breathe out for a count of 4. So try to make it double if you can. The longer your breath out, the more of that trapped air has a chance to escape. So the pursed lip breathing technique is very useful to help slow down the rate at which you're breathing. It will help you to recover faster when you're feeling short of breath, such as when you are doing something that's a little bit exertional, like you are going to climb a set of stairs or you have to walk a certain distance and so on. It helps to give you a sense of control over your breathing. Remember that the focus should always be on your breath out and try to make it longer but not forced. As I mentioned before, breathing in for 1 to 2 seconds and try to breathe out for 3 to 4 seconds. I recommend practicing this technique at rest when you're not struggling to catch your breath. That way, when you need to use it in case of emergencies, you'll be much more likely to find it easier to do. Body positions can also make a big difference in how quickly you recover from shortness of breath. As seen in that picture, you need to have a leaning forward posture where your arms are supported. So it could be sitting with your elbows on your knees, sitting near a table where you can lean over and get supported by the table, standing with hands on your thighs or leaning over against a counter. The idea is that by supporting the upper body, it will help to allow the accessory muscles to do more work more efficiently. It also helps to release the pressure against the diaphragm, allowing it to relax a bit more and also work more efficiently. So when you're trying to catch your breath, try to adopt one of those positions and then practice pursed lip breathing at the same time. A little bit of a larger picture for you to see a little bit better. So the benefits of coughing out secretions is that it helps to clear that stuff out of your lungs so that it prevents infections, keeps more open airways, therefore more fresh air can come in, and it will feel like you have less shortness of breath because the secretions are out of your lungs. So we want you to try and save energy, avoid coughing fits by using good coughing techniques. So first we'll talk about the huffing technique. So basically it's a bit weaker, if you will, than a cough, but it's very useful to help move secretions in the larger airways so that they can be coughed out more easily. So what you want to do is you want to sit comfortably, upright, and you want to practice just normal breathing. You want to ideally have taken your bronchodilator puffers at least 10 minutes before you want to try and get rid of secretions. That allows the medication to open the airways and the secretions to come out a little bit easier. When you're ready to try and clear secretions, you're going to take a nice, slow, deep breath through your nose. And when you go to exhale, you want to make a huff, such as if you're trying to fog up a mirror or fog up the glasses that you want to clean. So you breathe in and huff. You want to do it 2 or 3 times in a row, as this will help to really move those secretions up and out. Relax for a little bit and then repeat as needed. Sometimes when you have a lot of secretions, when they're moving on up in the airways, you can hear a little bit of crackling. So that way you know that they're really close to the top and you can then cough them out more easily. We really want you to avoid wasting energy on trying to clear secretions that are not high enough to be cleared. Controlled cough technique, you would be seated in the same position. Again, you would have taken your bronchodilators at least 10 minutes before. You inhale deeply through the nose. You can also have a little hold of your breath for me 1 or 2 seconds. This allows the air to kind of get beneath the secretions to grab them and move them up. Same thing as the huffing, you want to cough nice and strong a couple of times in a row to really move those secretions to the larger airways and hopefully out. Okay, so deep breath in, little hold, big cough. Try to avoid the little cough that are not strong enough to really do too much, and then it just kind of tickles your throat and then you cough and cough and cough and nothing happens, but you're wasting precious energy. Other things that might help you clear secretions are a device called positive or PEP device, positive expiratory pressure. And what those devices do is that you would breathe normally in through the nose. The device is placed inside your mouth, lips tightly sealed around it, and you breathe out through the device. There is a resistance to your breath out that helps keep the airways from collapsing, and there is also a little vibration that happens inside the airways that helps to kind of loosen the secretions so that they can more easily move up towards the larger airways. You would practice this same as the huff and cough. So at least 10 minutes after you've taken your bronchodilator puffers. And then you would just breathe normally in and out, trying to make your breath out a little bit longer than your breath in. And you want to try and do this for about 10 minutes, but it can be done up to 20 minutes. And for those that really have a lot of secretions, this little gadget can make a big difference. So it just makes it a bit easier to clear larger quantities of secretions. It decreases the amount of time that those people are coughing all day long. And overall, it will reduce the shortness of breath because there will be less trapped air in the lungs. So quality of life will definitely be improved. What's recommended is to try and use this device in the morning after taking your puffers, and in the evening again after taking your puffers. So we're hoping to avoid the coughing that often happens throughout the night. In case of increase in secretions or a flare-up, you can use this device several times throughout the day if you find that it's helping you to clear those secretions. And with secretions, it's always very important to kind of have a look at them and know what your baseline is, what it looks like, the quantity that you have, the color that it is, so that if you notice any changes, then you can mention it to your doctor so that you can be given the proper treatment. So if you're really struggling with your breathing, it can make going out very daunting. And we really want to make sure that you're able to go out to appointments, to visit family and friends, so that as a normal person would do. So if you don't have an accessible permit, there is a potential that you might qualify for one. So for those of you who have portable oxygen that you need to use all the time, you automatically qualify for an accessible permit. If you don't have that, but there is other, you meet other criteria, you can still qualify for it. And your doctor or physiotherapist is allowed to fill out this form that you would then take to the Ontario Service Center, and then they would process the form for you. The permit is assigned to you and not to the car. So if you're going with someone because they're driving you somewhere, you can take that permit with you and put it on the visible part of the car when you're parking, and it is now allowed to park in accessible parking spots. The other thing that's interesting to know about those accessible permit is that they allow you to park in no parking area. So very often, certain hospitals have very limited designated spots close by the door, and the parking lots don't apply to those rules, so you would still have to pay the cost of the parking lot to use the spot there. But sometimes you can park on streets that are just as close, but it usually is no parking. You're allowed to park in no parking areas with an accessible parking permit. You still should probably double check depending on the town that you're in, but most likely is that you will be allowed. The only place you can't park is in no stopping zones or on fire routes, designated areas. You may also qualify for a disability tax credit. So certain criteria, again, have to be met. This is a discussion that you should be having with your physician. There's a form to complete, but once it's completed and submitted and you've been accepted, then every year when you do your income tax, you will benefit from a credit for having a disability. So every little bit can help because we know that a chronic condition can be quite debilitating in all aspects of life. If you have supplemental oxygen and you're using a concentrator that's plugged into the wall at home 24 hours a day, you're also qualifying for an electricity support program by the hydro company. So you need to contact them, or you can find the form online to fill that out. And again, you get a discount on your electrical bill, which can be very useful. Other services like OHIP funded physiotherapy services are available to those over age 65 that don't have private benefits. So it can be useful to help you deal with other issues that are sometimes nagging at you. You have to find which clinic offer those OHIP covered services, but it can be a nice way to help you recover from other injuries. You might want to look at the air quality in the environment that you live in. Sometimes if you live in an older home, or if there is maybe heated with wood stove, that sort of thing, there's a lot of dust in the air, a lot of allergens in the air, that perhaps having a specific air purifying system with a HEPA filter could maybe make a difference in your overall shortness of breath on a day-to-day basis. There are also companies that specialize in assessment of the home specifically, and they look at various things that could cause poor air quality, and then make suggestions as to what could be done to improve the air quality in your home. Another thing to consider is to make sure that your house level of humidity is somewhere between 30 and 50%. So you can get that reading by a very inexpensive gadget called a hygrometer that will tell you what the level of humidity is in your house. Because if it's above or below that, it can cause condensation and mold buildup and that sort of thing, which we know are very negative influence on people with lung issues. So you need to address those situations right away, because it can make your breathing much worse. If you've ever heard of ozone generator as an air purifying thing, make sure that you stay away from that. The ozone gas is actually a very bad lung irritant, and you want to avoid anything that will irritate your lungs further, since they're already being impacted by the disease that you have. Duct cleaning doesn't usually change the air quality of the house per se, but it is recommended for a newly built house, or a house that just underwent some renovations that could have stirred up a lot of debris and dust in the air. So a nice little cleanup of the ducts might help to prevent that dust to be spewed out into your air environment every time that the heat exchange come on. What's recommended on top of that is really just general weekly cleaning with a vacuum. Avoid carpets as much as possible, because we know that they have more dust, they retain more dust than the linoleum or hardwood floor. If you have filters on your air exchange, make sure they are cleaned or changed on a regular basis. Any questions? Please make sure that you ask any questions to any one of our team members, and we will try to answer them as best we can. Any of the forms that we've mentioned in this presentation, we also have online versions of them that we can email to you, and you can just print it out at home, or we can send you the links to those online places that you can then access yourself at home and print in as well. Thank you so much for listening. Until next time.